Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ogun government asks residents to prepare for second round of COVID-19 vaccination exercise. And food security and child nutrition in focus. Yobe State laments progress made in breastfeeding during the last 4 years due to outbreak of COVID-19. And all 16 and 17-year-olds in the UK to be offered the Pfizer-BioNTech vaccines. Last night, Nigeria recorded 3 more deaths and 505 new cases of COVID-19 across 15 states and the FCT. The Nigeria Center for Disease Control, NCDC, in an update last night, noted that the latest statistics show a consistent increase in confirmed cases across the country. And this is indicating a third wave. It also comes as the Nigerian Association of Resident Doctors on Monday began an indefinite strike over complaints of irregular payments of salaries, allowances, members' welfare, health hazard allowances, among other issues. Let's take a look at the update.
The third wave of the COVID-19 pandemic in Nigeria has been characterized by a steady rise in the number of daily infections driven by the spread of the Delta variant in the country. The NCDC is asking Nigerians not to let down their guard and adhere strictly to all safety protocols. In the last 24 hours, the NCDC announced 505 confirmed cases reported from 13 states and the FCT. Lagos took more than half of the infection figure with 273 cases, followed by Rivers, which reported 83 infections. Oyo had 45 cases, Ondo recorded 22 cases, Cross River had 18, while 13 were registered in Kaduna. 10 cases each were reported in Ogun and Gombe states. FCT registered 8, Ekiti had 7, Delta 6, Bayelsa 3. 2 cases were registered in Edo, while Niger had 1. 0 cases reported from Plateau, Sokoto, Nasarawa and Osun states. The latest tally raises the number of confirmed cases in Nigeria to 175,264. 85 persons have been discharged in the last 24 hours, raising the total number of recoveries to 165,122. The agency reported 3 more deaths resulting from complications in the last 24 hours, raising the fatality toll to 2,163. With a recent increase in daily cases, active cases in Nigeria have jumped to 7,969, while over 2.5 million samples have been tested so far. 29 people associated with the Tokyo Olympic Games have tested positive for the virus, making a total of 300 confirmed cases as compiled by the Games Committee. Over 6.8 million confirmed cases and more than 172,000 deaths have been recorded across countries in Africa. The total global confirmed cases are getting close to 200 million, while deaths across the world have surpassed 4.2 million.
And to Ogun State, where the Commissioner for Health, Dr. Tomi Koka, has raised concerns over non-adherence to COVID-19 pandemic protocols by residents, a situation which she says has resulted in noticeable increase in the number of cases in the state on a daily basis. According to her, residents seem to have jettisoned the laid-down safety protocols as they go about their daily activities without the use of the precautions.
Residents of Ogun State throng streets and marketplaces, all in disregard to the social distancing rule, use of face masks and other preventive measures as advised by the NCDC. A visit to the motor parks also shows that hand washing, use of hand sanitizers and other precautions have been totally abandoned. Some residents believe the virus is no longer a threat.
I just feel that many people are not wearing, that's why I'm not putting it on. Although I have the face mask, but when I go to a bank or go to any social organization, I put it on. But in marketplace like this, many people don't put it on. That is why we are not putting it on. When only you put it on, it will be as if maybe you are out of what is going on. You don't know. Maybe your belief is different. You don't believe on what people believe. So that is why you look different.
You know, our people used to say, seeing is believing. Most of people, they did not see person that thing have happened to. Unless our people, if they see that person, they will not start panicking. It's just like when someone is traveling and saw a car have an accident, see how people is dead and how they're bringing people out. And also people will say, driver, take it easy. But the driver is running more than 100 before from their destination where they're coming from. So what I can say inside that very thing is that
this has also raised some concerns for the state government, a situation which they say has led to an increase in the number of registered infections. The State Commissioner for Health, Tommy Coker, is asking residents to avail themselves of the opportunity of the next round of vaccination scheduled to commence soon.
We'll be starting the next batch, and we will have a plethora, a choice of vaccines. We'll have the Moderna, we'll have Johnson & Johnson, we'll have the AstraZeneca, we'll have Pfizer, because we've got all the logistics to ensure the cold chain is maintained for all those types of vaccines.
There are still many Nigerians who have not been vaccinated and are potentially vulnerable. The message of adherence to non-pharmaceutical interventions remains the most effective way out.
And still in the southwest, the Oyo State government says it is scaling up sensitization efforts on the Delta variant of COVID-19 in the state to forestall more infections and resultant death. The incident manager and member COVID-19 task force in the state discloses that since June the 22nd, when the Delta variant was first discovered in the state, more cases have been discovered and also deaths recorded as a result of complications.
It's a busy day in Aggregate Market where we have come to gauge residents' compliance with COVID-19 protocols. The result is quite disappointing. Only 6 out of the over 300 people observed had nose masks either properly placed or hanging on their chin. Social distancing has become a distant memory. However, these residents have interesting things to say regarding their nonchalance to the observation of safety guidelines.
There is COVID-19 in Nigeria, but the only thing we need to do is to be covering our nose, all the prevention that government said we should be doing. We should be trying to do it as from now. That is the only prevention we should be taking.
Normally what we're told is to always cover our nose with nose mask and make sure that we take to all the rules and regulations concerning COVID.
The statistics of the new infections in the state shows an uncomfortable spike, and the COVID-19 task force set up by the Oyo State government is aware that residents have let down their guards. Meanwhile, the state has run out of vaccines, according to the director of Oyo State Primary Healthcare Board.
As at 8th of July, we've concluded all the exercise because we don't have any more vaccine in stock. For the first dose, we were able to cover as much as about 90,000 plus. Then for the second dose, we were able to immunize over 60,000.
While the surge continues, residents must embrace and strictly observe the COVID-19 protocols. However, to achieve this, sensitization may have to be backed with enforcement.
And persons living with disabilities are the worst affected by the coronavirus pandemic in Jigawa State. Well, this is the view of the chairman of the Joint National Association of Persons Living with Disability, Jigawa State chapter. According to him, many of their members have lost their jobs and businesses as a result of the pandemic, and this continues to negatively affect their lives. Our correspondent Sadiq Eliasu has more.
Along with its direct impact on many of those infected with the virus in Jigawa State, COVID-19 has profoundly affected societies in general. Economic disruptions fueled by the pandemic has pushed many vulnerable communities into extreme levels of food insecurity, some to the brink of starvation. This has become the fate of Zainab and 2 of her physically challenged sons who live in this hut in Damasara community in Dutse, the Jigawa State capital.
We have been suffering. Our only hope is when my children go out on their tricycle. Some people pity them and give them something. But in the last 2 months, we have been battling to even get 1 meal in a day. In the previous weeks, we didn't even get any food for many days. and the tricycle is no longer functional. They almost died until someone came to our aid.
In fact, I meet them in critical condition. I saw a video that is going around in social media, which I run from Kano to Jigawa. So when I saw the situation is very critical, so I took them to hospital where they are taking treatment. What caused the problem of the critical condition? Because during these lockdown issues, in fact, people are in bad situation, which they lost their jobs, and some of the business people lost their business.
The state chairman of the Joint National Association of Persons Living with Disability believes that they often face greater barriers brought about by the impacts of the pandemic.
COVID-19 trauma. What I mean by trauma is how persons with disabilities run out of a lot of things after the COVID-19. Many lost their jobs. Many cannot even stand on their feet again. And it leads even to starvation to some persons with disabilities.
With a surge in cases of COVID-19, a coordinated response by the relevant authorities will go a long way to offer some form of succor to the vulnerable population.
And away from Nigeria, Ivory Coast's President Alassane Ouattara is in self-isolation after being in contact with someone who had tested positive for COVID-19. The presidency stayed silent on the name of the person. President Ouattara has encouraged the Ivorian population to get vaccinated while observing the health measures put in place to fight the disease. If the president's isolation is prolonged, he might not take part in the official Independence Day ceremony on the 7th of August. Well, still ahead, we'll take you to East Africa, and this is where hospitals are becoming overwhelmed as one country witnesses a jump in cases. Do join us again. Welcome back. And back in Nigeria, the Yobe state government says that the outbreak of COVID-19 has affected the progress made in breastfeeding during the last 4 years. The Commissioner of Health in the state, Dr. Lawan Ghana, made the disclosure at the commemoration of the World Breastfeeding Day in Damaturu, the state capital. It further reveals the pandemic has caused significant disruption in the production of baby food, thereby increasing the risk of food insecurity.
While there has been progress in breastfeeding rates in the last 4 decades, with a 50% increase in the prevalence of exclusive breastfeeding globally, the COVID-19 pandemic highlights the fragility of those gains. In many countries, the pandemic has caused significant disruptions in breastfeeding support services, while increasing the risk of food insecurity and malnutrition. Several countries have reported that producers of baby foods have compounded these risks by invoking unfounded fears that breastfeeding can transmit COVID-19 and marketing their product as safer alternatives to breastfeeding. In Nigeria, where 1 in 8 children do not reach their 5th birthday and 3 in 10 children are stunted, optimal breastfeeding practices are known to reduce neonatal and child morbidity rates as well as stunting reduction. Optimal nutrition provided by breastfeeding, along with nurturing care and stimulation, strengthen a child's brain development with positive that endure over lifetime.
Well, we continue talking about the pandemic, and this time in the African continent. Kenya is a country that is grappling with the coronavirus, and this is the Delta variant, highly transmissible, which recently resulted in the western part of the country being put into lockdown, which now threatens the capital, Nairobi. Joining us right now, Dr. Diana Achando, Medical Officer, Aga Khan Health Services, joins us from Nyanza, Western Kenya. Thank you for joining us on the program.
You're very welcome.
All right, Dr. Achando, the Kenyan government seems to have reacted quickly, and this is to the previous 3 waves. But what's happening now? What's the situation?
We just recently got out of a lockdown in the Nyanza Western area. We are seeing a sudden rise in the number of cases that we are noting in Nairobi, which is the capital city. So we're having a shift of the epicenter moving from Nyanza Western region towards Nairobi. So the restrictions that were actually enacted a few months ago have been lifted for this region, and we are considering moving them actually to the capital city, essentially.
What would you say happened that it appears Kenya was bracing for the 4th wave?
I think there's been a bit of social events. We're seeing more and more people attending funerals and weddings. We have a lot of travel in and out of the country and within the regions, which is allowing this spread. So we are seeing an increase in the infection percentage. So we have at least 15% of people who are testing positive for this. The Delta variant is, of course, highly infectious, way more than the previous variants that we had. So I think it's introduction of the Delta variant and just relaxation of the general populace in terms of the rules that we've put in place.
In your opinion, do you think coming out of lockdown is, the best decision right now in terms of this Delta variant and, the many cases the country is recording?
I definitely think we should be considering a lockdown within the capital city, which has shifted to being the new epicenter. I don't think coming out of the lockdown is the wisest idea. However, there is a lot of speculation when you're in social circles that it might be for political reasons, where people want to start campaigning because we have elections next year. And in fact, the shift of the epicenter coming towards Western Nyanza was because we had some sort of political celebration. And so we are seeing the effect of this. We have been grappling with these effects for a month or two after, and it looks like that's what's going to happen in Nairobi. So it's definitely not the wisest thing. However, the motivations may be more than people's health.
But indeed, with all of this, the economy and social life in general is also negatively affected. But how is this affecting you as a healthcare worker?
Definitely fatigue. You have to be extra careful for the last 1 year. So I note a lot of fatigue amongst my colleagues and myself as well. You get a little bit tired of being, ostracated around people who you used to know. You get a little bit tired of having to wear a mask and sometimes 2 masks most of the time, or wear PPEs. So this is definitely affecting healthcare workers in that way. You're also highly likely to get this disease, because unlike the rest of the population, we have more and more people that we are seeing coming in with respiratory symptoms. This is most likely COVID. So we're at a higher risk. It's definitely affecting the mental health of healthcare practitioners. So we're seeing a lot of organizations trying to emphasize on mental health, especially for healthcare practitioners.
And still on healthcare practitioners, in terms of welfare, how much is the government providing? One is the PPEs, the tools that you need to fight this pandemic, protect yourselves, and of course, man the healthcare systems. How much is government supporting health workers in Kenya?
We have a lot of support from non-governmental organizations, that we must admit. We've had times where certain counties, because the country is run in counties, it's a decentralized system. We had certain counties saying they can't see patients anymore because they don't have PPEs. So the PPE supply has been better than it was, for instance, 6 months ago. However, it's still not excellent. We still have some staff who are not able to access all the PPEs they need. However, there's been vast improvement from when we began the pandemic. And we're slowly seeing the Kenyan government stepping in a bit more to make sure that the healthcare workers are protected.
I want to come back to the virus again, and this is with some people commenting that a country like Kenya is experiencing low deaths from the virus. I mean, any death is still a death, but do you think that there is a reason or more why this is the case? Are people doing anything differently in Kenya? I
think for Kenya, the explanation we would have is the COVID is highly infectious in slightly older people. Most of Kenya's population is actually under 35. So you have more and more people who are not as susceptible to this disease as you would have, for instance, in European countries. So the population and the distribution of the population is definitely a big deal. And then, of course, we have also a good amount of the Kenyan population is not urban, meaning you don't have a lot of people interacting as much as you would, for instance, in major cities, if you're thinking about New York or Paris. It's a lot of, we have some rural areas, so you don't have a lot of those people mixing up as much as you would in urban areas. And then, of course, I think maybe it's just not excellent statistics. We have people dying and we don't have a cause of death. We don't have enough medics to actually do these postmortems to find out what killed these people. We still aren't excellent when it comes to testing, because a lot of people, to be able to access testing, it might be expensive for most people. And so maybe we're not testing enough. Maybe we don't know these people had COVID before they died, and we're not doing enough postmortems. So those are the factors I would attribute it to. And of course, the weather.
Okay, and finally, Dr. Chando, we are not excellent with vaccination, are we?
No, we are not at all, even amongst healthcare workers. I have several colleagues who are hesitant on getting the vaccination. We have a lot of conspiracy theories in the public. We have a lot of people worried that this might influence their reproduction. We have people worried that getting the vaccination might lead to a blood clot. So we don't have a lot of people who are believing that this is actually a good thing. And so we are currently at just about 2% of the population who have gotten a vaccine, and we have about 1.3% fully vaccinated. So people are a little scared of the second dose, because we are using the AstraZeneca dose. We are also using the Pfizer one. And you have some people who are a little bit afraid of getting a second dose because they're reeling from the side effects of the first one.
We appreciate your time. Thank you so much. Continue to stay safe. Dr. Diana Chando is a medical officer with Aga Khan Health Services. Thank you so much for joining us on the program.
You're welcome.
Indonesia's coronavirus death toll topped 100,000 on Wednesday as the country struggles to control the spread of the Delta variant. Southeast Asia's biggest economy has now detected Delta in dozens of regions since it was first found in June. Here's more on the global update.
China's Wuhan city is undergoing tests on its 12 million residents for the coronavirus after confirming its first domestic cases of the highly transmissible Delta variant. Wuhan, where the virus first emerged in late 2019, had reported no local coronavirus cases since mid-May last year. But on Monday, August the 2nd, authorities confirmed 3 cases of the Delta variant. The strain has been found in a handful of provinces and big cities, including Beijing, over the past 2 weeks. Japan has warned that coronavirus infections are surging at an unprecedented pace as the new cases hit a record high in Tokyo, overshadowing the Olympics and adding to doubts over the government handling of the pandemic. Over the past 24 hours, Tokyo reported a record 4,166 new cases, while the number nationwide rose to 14,204. In Indonesia, deaths from the coronavirus have crossed the 100,000 mark amid an exponential surge in cases over the past month, driven by the highly transmissible Delta variant. Indonesia reported 35,867 new coronavirus cases and 1,747 new deaths, bringing the total number of cases and deaths to 3.53 million and 100,636 deaths, respectively. The government has announced an extension of curbs on movement until next week in some parts of Southeast Asian archipelago. In Nepal, hospitals are preparing to take in more coronavirus patients as the Delta variant is showing signs of spreading in the Himalayan nation, medical officials said on Wednesday, August the 4th. Authorities have extended the lockdown, which was due to end today, by a week to stem the spread as new cases rose by more than 3,000 on Tuesday. An Australian man in his 20s died at home of COVID-19 in Sydney one of the country's youngest coronavirus deaths. The man, who was unvaccinated, was 13 days into home isolation after testing positive when his health deteriorated rapidly, authorities said, adding that he lived with one person who had been hospitalized with the virus.
Continue to take responsibility. You can visit our website for more updates, a better understanding of the pandemic. You find breaking news and other stories. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.